Hantavirus is a rare but life-threatening respiratory disease primarily transmitted to humans through contact with infected rodents, such as the deer mouse or white-footed mouse. Unlike many viruses that spread through bites, hantavirus is typically contracted when individuals inhale airborne particles contaminated with the urine, droppings, or saliva of these pests. A common occurrence when sweeping or cleaning dusty, enclosed spaces like sheds, attics, or crawl spaces. The symptoms of Hantavirus Pulmonary Syndrome (HPS) often appear in two distinct phases. Initially, the illness mimics the flu, presenting as fatigue, fever, and significant muscle aches in the back and thighs. However, as the disease progresses, usually 4 to 10 days after the first symptoms, it takes a dangerous turn into a respiratory crisis. Patients may experience sudden shortness of breath, severe coughing, and a feeling of tightness in the chest as the lungs begin to fill with fluid. Because the condition escalates rapidly, immediate medical attention is vital for anyone experiencing respiratory distress following potential rodent exposure. Prevention centers on effectively sealing up and cleaning up to minimize contact. Homeowners should seal any gaps larger than a pencil eraser to block rodent entry and use snap traps to clear existing infestations. When it comes to cleaning, the golden rule is to never sweep or vacuum droppings, as this aerosolizes the virus. Instead, the area should be thoroughly soaked with a disinfectant or a bleach and water solution for at least 5 minutes before being wiped up with paper towels and disposed of in sealed bags. By maintaining a rodent-free environment and utilizing wet cleaning methods, you can significantly reduce the risk of infection.